Hi, everybody. Thank you for joining me today. I'm here to discuss some common foot and ankle problems that I oftentimes see in my clinic, and the most common foot and ankle problems that bring people in to see me and that affect people. Thanks again for joining me today. So we'll go right in. So just basics on the anatomy of the ankle. There are three bones that make up the ankle joint. We've got the tibia here, which is the end of the shin bone, the fibula, which is that little pointy knob on the outside of your ankle, and then the talus, which actually lives inside the ankle. The foot itself actually has 26 bones. You have the hindfoot region here, the midfoot, and then the forefoot bones. So pain in the ankle itself can be due to several different things. Acutely, a lot of times I'll see people come in with a twisted ankle, just a basic sprain, or they'll have broken their ankle, and so they present to my clinic. And the more chronic type issues I'll oftentimes see are problems like arthritis or tendonitis. And these are problems that go on for several months or even years. So for ankle sprains, this oftentimes brings people into urgent cares or emergency departments or orthopedic offices or even their primary care offices frequently. Really, the treatment is pretty straightforward. Most people will get better over the course of several weeks to months after an ankle sprain. And the treatment, as most people are aware, is just simply rest, ice, compression, and elevation. The injury that occurs is to the outside ligaments of the ankle here, which is why most people, when they have a rolling of their ankle, will experience the pain on the outside of their ankle. For people that actually break their ankle or they have a more significant injury, fractures can be divided into a couple different flavors. So you can have fractures that are stable. If you can see this top x-ray here, you can see a small crack in the bone here, and that's actually a stable fracture. That is a fracture that people can actually continue to walk on that does not need surgery. So the treatment is simply something like a walking boot or a walking cast. Obviously, if somebody has this type of injury where there's displacement of the ankle and the x-ray just does not look anatomically correct, the treatment is surgical. Arthritis is another common thing that I oftentimes see. So normally in the ankle, you'll have a nice joint space that you can see on x-ray. You'll have good movement of the ankle joint, but a lot of times people will develop arthritis, whether they've had a prior injury or if it just develops on it by itself. And here you can see that there's really bone-on-bone arthritis. It's just like arthritis in anywhere other parts of the body where you wear down the cartilage, and then you have that bone-on-bone arthritis that causes a lot of pain. You don't necessarily need surgery if you have arthritis in your ankle. A lot of times we can do things like bracing. This particular brace here is called an Arizona brace, and that's a custom brace that people can use long-term. And then there is surgical treatment in the form of either a replacement or ankle fusion, depending on the patient and what outcome they want, how old they are, and really what their goal is. So ankle replacement, that's been a technology that's come about in the past couple of decades, and that's really reserved for individuals that are lower demand, don't do any types of running or high impact activities, don't do heavy labor jobs, because these implants can only take so much impact. So these are implants that will preserve some ankle motion, but again, they are limited in the types of activities that you can do after an ankle replacement. Ankle fusion, this is really our gold standard and the old type of treatment that we've had for ankle arthritis. And this is essentially taking away that arthritic surface and making the bones one bone. If you take away that arthritic surface, you take away the bone-on-bone arthritis rubbing against each other, and you take away the pain. This is the type of surgery that we recommend for younger individuals or individuals that have higher demand jobs or like to do higher demand activities, because this type of surgery creates a stable joint that you can put a lot of pressure on. On the inside of the ankle or the medial ankle, most oftentimes I see people come in with a flat foot deformity or what we call posterior tibial tendon dysfunction. The posterior tibial tendon is a tendon that actually runs on the inside of the ankle. And this tendon can actually contribute to people being flat footed. So most of the time that I see pain in the inside of the ankle, it's due to this dysfunction. Posterior tibial tendon dysfunction, these patients will often present with a flat foot deformity. Their ankles will roll in. And a lot of times they don't need any surgery for them. We can treat them simply with orthotics, an Arizona brace again. But if they do fail the conservative treatment, we do go on to treat these surgically. And oftentimes, depending on what the patient's flat foot looks like, we'll have to do tendon transfers, bony corrections, or even fusions of some of the joints in the foot. On the outside of the ankle, the most common cause I see there in that area, besides ankle sprains, have to do with the peroneal tendons. There are two tendons that run along the outside of the ankle. And for whatever reason, these can oftentimes get inflamed. Sometimes people will just wake up in the morning and they'll say, geez, the outside of my ankle is really bothering me. I didn't do anything. I didn't sprain my ankle. I didn't twist it. But it'll often be times due to inflammation just in that area and in those tendon sheaths. For this type of issue, again, you can do things like bracing, and you can also do surgery. If there's a tear in the tendon, you can repair it, or some people, they'll have so much degeneration or the tendon is just not usable again, and they'll actually need a tendon transfer. A lot of times pain in the back of the ankle or in the back of the heel will be due to the Achilles tendon. A lot of people will have a bump in that area, and that will be due to Achilles tendinosis. That's just when over time the tendon just kind of wears and tears and you get a small little bony bump on the back of the heel there. And that can again get inflamed and cause a lot of tenderness. It's not necessarily a bone spur that is the painful area in the back of the foot. Many people think, well, I've got a bone spur back there, and that's the reason I'm having so much pain. It's actually the inflammation where the tendon attaches to the back of the heel. For another type of injury that I'll see is an Achilles tendon rupture. This usually occurs in younger individuals. They're playing basketball, they're playing soccer, and they feel a pop in the back of their ankle. But sometimes it can happen in people that have degeneration in that tendon, and then all of a sudden they'll twist their ankle or they'll step into a hole and that tendon will rupture. So for older individuals or individuals that aren't very active, there's really good data that you can actually treat these without surgery. And typically it's non-weight bearing in a cast for about 6 weeks. For individuals that want to decrease their risk of re-rupture rate or they're more active and younger, typically we recommend surgical repair for those. Again, Achilles tendonitis, if you just have pain in the back of the Achilles tendon because it's inflamed, really the treatment is just rest, immobilization, and also physical therapy for Achilles eccentric stretching exercises that therapists are well versed in. Pain at the back of the heel, again, that's Achilles tendinosis. So you get that degeneration of the tendon, and that can cause swelling in the back of the heel, swelling at the heel and then at the Achilles tendon. And again, the treatment is really rest, bracing, physical therapy, and then surgical treatment when all else fails. On the bottom of the foot, plantar fasciitis is the most common cause that I see for pain on the bottom of the foot. Most people will say, I've got pain right under my foot, right under my heel. And that's where the plantar fascia, which is a band of tissue that spans the bottom of the foot, inserts into the bottom of the heel. Metatarsalgia is actually pain in the forefoot, so pain in the ball of the foot. And that's another very common cause of pain in the foot. So for plantar fasciitis, again, the plantar fascia is a long band of tissue that spans the bottom of the foot. And oftentimes that'll cause pain in the arch of the foot and also pain at the heel. Mostly the treatment is conservative. I would say the vast majority of people get better with just conservative treatment. And that includes plantar fascia specific stretching, use of a night splint, which actually keeps your foot in a neutral position at night, using a soft cushion or a silicone heel cup when you're walking. And then finally, for that small minority of patients that don't improve with non-surgical treatment, there is surgical treatment for it. Pain in the forefoot, this will oftentimes happen as individuals get older because you lose that fat on the ball of the foot. So the metatarsal heads, which are the long bones in your foot, will actually start putting more pressure on the ground. And that pressure will lead to painful calluses, and that can cause a lot of difficulty walking. This is something that affects a lot of people. It affects myself. And really one simple type of treatment is just using a simple pad to offload that area. And that can be quite effective. If it isn't, then you of course have surgical options. Moving on further down the foot, the midfoot is really comprised of the tarsal bones. This is what we call the tarsal bones. And most of the time, pain in the midfoot, if it's not injury related, is due to arthritis. For midfoot arthritis, there are bracing options. Usually a good orthotic or a good arch support is very helpful, but there are braces that are custom, such as this one. This is called a UCBL brace. That'll actually control the motion in the midfoot that you can use in a shoe, and that can be quite effective. If patients continue to have pain despite conservative treatment like bracing or injections, then you can do fusions of these small joints in the midfoot. Now the forefoot is the very front of the foot. So that comprises the phalanges or the toes and the long bones, which are the metatarsals. Pain in the forefoot can be due to a lot of different things, but one common thing that it can be due to is a stress fracture. And that is simply as it sounds. It's just constant repetitive stress to the bone that causes a small fracture in it. If you take an X-ray weeks and weeks later, you'll actually see the bone healing. So these are stable fractures that people will continue to walk on, and they're oftentimes not found because they don't come into the doctor. It just kind of resolves itself. Other issues that can occur in the forefoot are something called a Morton's neuroma, bunions, which most people are aware of, arthritis, and toe deformities like hammer toes or claw toes. So a Morton's neuroma can often differentiate itself from something like a metatarsalgia or pain in the bottom of the foot because it causes pain between the toes on the bottom of the foot. It's actually a disorder of the nerve that runs along the bottom of the foot and branches out to the toes. Since it's a nerve, it can cause numbness and tingling into the toes. But the treatment does not have to be surgical. Again, you can use something to offload the forefoot like a metatarsal pad, or worst comes to worst, you can have surgery to excise the nerve. Bunions are pretty common. Most people know people with bunions. And again, that is just a deformity here in the forefoot. Usually it's the pain associated with it is due to shoes. People just have their bunions pressing on shoes. So you can do things like using a soft cushion when you're wearing shoes to help cushion that area. Using wide shoes and using toe spacers can help. And finally, if people continue to have pain, despite using wide shoes and bunion guards, or if they have pain just walking in bare feet, they'll usually opt for surgical correction of their bunions. Arthritis can also occur in the foot. A lot of times it'll occur in the big toe, and this will be just what we call idiopathic. It'll just develop on its own, and it can cause a lot of swelling, which rubs against the shoe, or it can just cause pain in the joint. One good treatment for it is just a stiff insert, which is called a Morton's extension, that helps to limit motion in that joint. And if people continue to have discomfort from it, they can go on to have a fusion of that great toe joint or surgery for it. And most people will do quite well. It doesn't necessarily restrict much of their activities. It does restrict motion in the toe. So if you're trying to do ballet dancing or get into certain yoga positions, and that's going to be difficult for you, but most times people won't notice any restriction in their activities. Toe deformities are oftentimes common. Most people will present with a hammer toe, but there are other deformities called mallet toes and claw toes, but these can be very painful because they push up against the top of people's shoes, producing really, really hard calluses and pain in that area. Things that you can do that are not surgery for hammer toes are taping. So you can tape your toes if they're flexible. You can use something like a hammer toe crest in a shoe to make it more comfortable. And finally, there is surgical correction if none of that works. So that's all I have today on common foot and ankle issues. I thank you for your time. And if you ever have any questions for myself or our physical therapy department, please let us know. We're more than happy to talk to you and answer any questions that you have or help you diagnose any problems that you're not sure what they are.